Melissa.
Thank you, Melissa. We will vote in this committee voting session today on 5 bills. Before we get to them, I want to first say welcome. It's nice to have you all together, and welcome to people who may be following this on YouTube. And then I want to say that these bills, I believe, were all heard last year and passed the subcommittee, passed the committee. Is that correct, LAs?
Correct. Correct.
Thank you. So remembering that we passed them last year, having spent a great deal of energy getting them to the form that they're in and believing they were in pretty good form last year, this is a little different than a bill that hasn't already passed, bills that have not already passed our subcommittee, our committee, and our body. These also, many of them passed out of the House. So with that, I will start with House Bill 119. Erin, I think?
Yes, that's me. The bill requires the Department of Health, in partnership with the Maryland Department of Aging, the Virginia I. Jones Alzheimer's Disease and Related Disorders Council, and the Maryland chapter of the Alzheimer's Association, to incorporate information regarding cognitive impairment, Alzheimer's disease, and other types of dementia into relevant public health outreach programs to educate healthcare providers and increase public understanding and awareness.
And are there any changes in this bill from the bill we passed last year?
There are none.
Are there any questions? Let's start with, would somebody like to move the bill? Normally it's the subcommittee chairman, even though these haven't gone to subcommittee.
Move the bill.
Is there a second?
Second.
Are there questions? All those in favor of the bill say aye. All those opposed to the bill, raise your hand in the reactions. So if you oppose the bill, I need you to raise your hand. I see no hands raised. Therefore, this bill passes the committee unanimously. May I give you all a round of applause to say to you, I'm grateful to have that first step taken in our committee. I wasn't sure how it was going to go. Well done on everybody's part. We'll see if we can get through the next 4 bills. It's good we're doing things that are not too difficult for the first. I don't want to call it a rehearsal because it's real. Oh, somebody put up a little icon. So with that, we'll move to House Bill 224. Tyler.
House Bill 224 requires the Department of Information Technology to, in consultation with the health occupation boards, to review the IT platforms that each board uses, the administrative functions that each board has to undergo, and their costs, recommendations on the feasibility and cost of developing a common standardized platform for each of the health occupation boards to use.
Have there been any changes made to this bill as it passed the House last year?
No.
Thank you. Would someone like to move the bill?
Move favorable, came out of our subcommittee.
Is there a second?
Second.
Is there any discussion or questions about this bill? Seeing none. All those in favor say aye.
Aye.
Those opposed, please put up your hand in the icon in the reaction section. I see no hands up in the panel. This bill passes unanimously. Nick looks like he made it. Yay, but you got to be actually here with your face and your, there you go. Perfect. Good. Delegate Kipke, we're glad to see you.
Happy to be here.
Next, House Bill 290. Tyler,
House Bill 290 increases the time for filing a complaint with the Maryland Commission on Civil Rights that alleges an unlawful employment practice other than harassment. A complaint must be filed within 300 days after the date on which the alleged discriminatory act occurred. A complaint filed with the Federal Human Relations Commission within 6 months or a local Human Relations Commission within 300 days must be deemed to have complied with these requirements.
and are there any changes from last year?
No.
Thank you. Would someone like to make a motion?
I move, as chair of the subcommittee, move favorable.
Second.
Thank you. Is there discussion or are there questions? All those in favor say aye.
Aye.
Who are opposed to this bill, please put up your raised hand icon. I see no hands raised. Seeing none, this bill passes our committee unanimously. We'll now move to House Bill 321. Tyler,
House Bill 321 requires changing facility suitable for providing personal care for an adult to be installed in at least one public restroom within a public building constructed on or after October 1st, 2022. The requirement will also apply to public restrooms in an existing building that's being substantially renovated or built after October 1st, 2022. And then this bill also requires that state and local entities report the location of any of these changing facilities to 211 Maryland, Inc., which will maintain a list on their website of these locations for people to access. There are no changes from last year's version of this bill.
thank you. Is there a motion?
Move favorable.
Second.
Second.
Is there any discussion or questions on this bill? Here, seeing none, all those in favor say aye.
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 Opposed, please raise your hand icon. I see none. Therefore, this bill passes the committee unanimously. House Bill 393, Aaron,
This bill renames the Office of the Inspector General in the Department of Health to be the Maryland Office of the Inspector General for Health, and it establishes it as an independent unit of the state. It is identical to the bill as it passed the House last year.
is there a motion
Move
So moved.
favorable. Move favorable.
and a second?
Second.
Is there discussion on this bill? All those in favor say aye. Aye.
Aye.
All those opposed, raise your hand icon, please. I see no hands raised. Seeing none, this bill passes HGO unanimously and will be sent to the floor at some point. That actually ends the votes for the day. I see nothing on the back. Is there anything, since we're all together, that anybody needs to ask? This is an opportunity to ask me a question if it needs to be done in the body versus a phone call. Okay. Well, that went smoothly. Who knew? You guys did a great job of figuring out how to do this at our organizational meeting. I thank you all for your contributions. I'm really quite pleased. It will get a little harder, we all know, when there are more controversy, but and I think that probably at our next voting session, there may be a bill that comes out of subcommittee, maybe even a few. Thank you all very, very much. And with that, I'll let you go and have a wonderful afternoon and evening.
Take care.